Hi, my name is Dr. Dillon Remmick here with HealthSource Chiropractic in Baxter. Last video we did, we talked about disc problems in the lower back that lead to sciatic pain, pain shooting in the leg, what they call radiating pain. Today we're going to talk more about the neck. The machine that we have here is called the decompression machine. It can be used in a couple different areas. It can be used on the lower back, but it can also be used on the neck. So we have Brittany here today who's getting some cervical decompression done on her neck, and what that specifically is for, if you remember from the last time that we talked, is that when somebody has a problem, this is where the head sits, this is the front side, this is the back side, so here's the neck. We have bone, disc as we go down. Sometimes when we have injuries or chronic problems over time, it can lead to a disc bulge or a disc herniation. In the lower back, this is what it looks like. But in the neck, the same thing can happen, and you can see that that can compress a nerve down here, which is this yellow guy here. Now, when the nerves get compressed in the neck area up top here, what tends to happen is pain that goes into the arms. Sometimes it's numbness, sometimes it's tingling, sometimes they get weakness, so you start to struggle with buttoning your shirt, or you struggle with starting to drop things. Initially, maybe it's just a pencil, and then all of a sudden you grab a glass and you drop the glass out of your hands. Okay? To give you an idea on an X-ray what that looks like of the problems that we're working on, this here is a picture of a neck facing this way. Here's the back of the mouth. Here's the back of the head. So we're looking at it from the side. We have bone, then we have disc is the black space, bone, disc. These two discs, if you can see right here, are wearing quite significantly. You see the spaces are smaller. On the front edge of the bone, there's some pointed surfaces. Those are what we call bone spurs. This patient needs to decompress those discs so it makes spaces for those nerves actually to come out. Okay, so as you can see on Brittany, what's happening is this is placed lightly under her neck, gently over her head, and all this machine is purposely doing is pulling and opening those discs up, and then it lets them relax. It pulls and opens them up and lets them relax. And as that happens, what it does is it starts to pump the disc with healthy fluid, and eventually the bulge in the disc starts to go away. Okay, many patients after one or even two treatments can have significant improvement, especially with pain in their arms. If you know of somebody that could use some help, or you need some help, tag yourself below, ask us a question, we'll be glad to answer, or give us a call, we'll be glad to see if there's something we can do to help.